Hello friends, today I am going to discuss an important medico-legal case involving very common ailment and very common surgical procedure which came to Honorable Supreme Court as a civil appeal number 4126 4127 2022. This civil appeal involved Mr. Harnek Singh as an appellant and Dr. Gurmeet Singh as respondent. The facts of the case were as follows. Mrs. Manjeet Kaur, resident of Patiala, 47-year female, developed abdominal pain on 13th July 2004. She consulted Dr. Gurmeet Singh, who was practicing surgeon in Patiala. Ultrasound examination was done, which revealed the presence of gallbladder stone. Surgeon recommended laparoscopic cholecystectomy after certain medical tests. On 28 July 2004, surgeon performed laparoscopic cholecystectomy and placed an abdominal drain. On 29 July 2004, Mrs. Manjeet Kaur complained of abdominal pain and distension. Abdominal drain fluid was slightly green, which later on turned greenish brown. On 30th July 2004, she became very serious. Abdominal distension and pain were compounded by difficulty in breathing. At around 9 p.m., Mrs. Manjeet Kaur was shifted to Dayanand Medical College and Hospital, Ludhiana. At DMC Ludhiana, CT scan of abdomen was done, which showed moderate intra-abdominal and subphrenic collection and free air in peritoneum. Intestines were mentioned as grossly normal. On 2nd August 2004, abdominal drain fluid became feculent and foul smelling, indicative of colonic perforation. On 3rd August 2004, emergency laparotomy was performed in view of deteriorating patient condition. There was large peritoneal collection of intestinal contents due to colonic and bile duct injury. Patient's condition deteriorated further, resulting in multi-organ failure, resulting in her death on 11th August 2004. In 2006, after considering the evidences and hearing both the parties, State Commission directed the surgeon and hospital to pay a total amount of 15.5 lakh to the complainant, that is Mr. Harnek Singh. Dr. Gurmeet Singh appealed in National Commission, which held that he was not negligent in his conduct. Complainant also made a complaint to Punjab State Medical Council against the professional misconduct of surgeon and later on filed an appeal to MCI. MCI examined the matter and referred the appeal to its ethics committee. Ethics Committee found that Dr. Gurmeet Singh has failed to exercise adequate medical competence in treating the patient, as is apparent from the following points. A. There was a large bowel perforation after the laparoscopic operation. This complication, which though not known in the normal course of time, had occurred in this particular case. This complication could have been prevented if care had been exercised during the procedure by Dr. Gurmeet Singh. B. More important, Dr. Gurmeet has failed to suspect the occurrence of complications despite following warning signs and symptoms. Number 1, the patient was not recovering after the operation. Number 2, patient increasingly deteriorating. Number 3, there was a strong indication of a complication occurring after the procedure. Thereafter, his failure to detect all these conditions led to a delay in diagnosis, all perforation of the bowel, and has to lead a situation of avoidable delay which causes increased deterioration of the patient. In view of the clear findings, MCI decided to issue a strict warning to respondent, that is Dr. Gurmeet Singh, to be more careful during the procedure and to be more diligent in treating and monitoring his patient during and after the operation. Thereafter, complainant appealed to the Supreme Court. and Honorable Supreme Court relooked on the findings of MCI Ethics Committee as under: number 1. Existence of generalized peritonitis as a result of bowel perforation. Number 2. There was a significant delay in its diagnosis and operative intervention, first at the local hospital and subsequently at DMC Ludhiana. Number 3. This has led to the unfavorable outcome. Number 4. Shifting of the patient by Dr. Gurmeet Singh was done in a distant hospital where better GI and ventilatory facility are claimed. Number 5. Minor bile leak during surgery is accepted by Dr. Gurmeet Singh. This kept on increasing in the post-operative period. Bowel perforation and bile duct injuries were noted in surgery done later on by Dr. Atul Mishra at DMC Ludhiana. Number 6. Dr. Gurmeet Singh has failed to exercise adequate medical competence in treating the patient as is apparent from the facts. Number 7. There was a large bowel perforation after the laparoscopic operation. Number 8. The complication, which though not known in the normal course of time, had occurred in this particular case. This complication could have been prevented if care had been exercised during the procedure by Dr. Gurmeet Singh. Number 9. Dr. Gurmeet Singh failed to suspect the occurrence of the complication despite warning signs and symptoms. Number 10. Dr. Gurmeet Singh ignored the following factors, namely: A. Patient was not recovering after the operation. B. Patient's condition was increasingly deteriorating. C. There was a strong indication of a complication occurring after the procedure. And number 11. Failure of Dr. Gurmeet Singh to detect the warning signs symptoms led to a delay in diagnosis of bowel perforation, and this has in turn led to a situation of avoidable delay which eventually caused increased deterioration of the patient. Finally, Honorable Supreme Court stated the above referred findings of the MCI on the conduct of Dr. Gurmeet Singh leave no doubt in our mind that this is certainly a case of medical negligence leading to deficiency in his services, and the interest of justice would be subserved if surgeon and hospital are directed to pay to the complainant a total amount of 25 lakh with an interest of 6% per annum from 2006. Thank you.